Welcome to Monday's edition of the Megacast. My name is Dave Scott. Here in our Lakes FM studios, we are live in the Megacast on WAHS 89.5 Avondale Community Radio, 88.1 WBFH, The Biff. It's in Bloomfield Hills, and 89.3 Lakes FM. We are also live today on Civic Center TV and lakesfm.com. So lots of places to watch. Our Facebook partner for today is Bees in the D. We'll find out about them later on. But they have a huge Facebook page. We're really excited they're there. If you've not been a part of the show before, this show is here to provide local information on the coronavirus in and around our communities. An awful lot going on. The governor will be checking in just a couple of minutes. We will hear from her in Lansing, and another big announcement from the governor. Greg Flynn from the West Bloomfield Police Department will check in. West Bloomfield Fire Department will check in just a couple of minutes. And we're going to talk to a local pilot who worked with a bunch of other folks in our area to help get some needed medical supplies right here into our area. But joining us right now is the chief of the West Bloomfield Fire Department, Chief Greg Flynn. It looks like you're standing there in the garage at the fire station. Chief, good morning.
Good morning, Dave. Yep, we're here in the apparatus room, fire station number 5, and just prior to the broadcast going live, the crews just responded to another medical in the township here, so I'm all alone.
I got to be honest, I've heard a lot of sirens, and I watched the national news, and they're talking about Oakland and Wayne County. The president and those in the press conferences we got to be right in the thick of it.
We are, and we're looking at, it was 3 weeks ago on Friday that we opened the Emergency Operations Center here in West Bloomfield, along with the county opening theirs. And I tell you, I don't know where these 3 weeks have gone, Dave. A lot has happened since we first spoke. And, I think what I'm most concerned about, and I hope a theme that we can carry through today and through the week, is that this is not the time for us to let up. That the hard work that we've put in up to this far, we're hoping to see some payoff in the coming weeks. And tomorrow will be the 2-week mark for the stay-at-home order issued by the governor, if my math is correct. So we're just achieving that first major step that we took. And now we hope to see some of the fruit from that action.
We're going to talk to folks at Henry Ford Hospital, West Bloomfield, in a little bit, but I know they really have their hands full. You've been responding to people in the West Bloomfield area. I know other departments are responding to other hospitals across our listening area, but from a very local standpoint, and that one hospital, do you have any sense of how they're doing from a capacity standpoint?
So we speak with our friends over at Henry Ford on a regular basis, and what we're hearing from their staff is, yes, they're busy. Which one can infer from everything that's going on, but they are holding strong, that they are in a good spot. Their staff is resilient. Their staff is really embracing what they're being called to do and the very challenging patients that they're being asked to care for. So with all of that being said, Henry Ford West Bloomfield is, again, a great partner, standing strong with the WBFD, and very pleased with what their staff is doing and how that hospital is maintaining operations for the community here.
We've been talking to some of the police departments over the last couple of days, and the one piece of good news, they say their calls are down. 911 calls are down because there aren't as many people out on the streets. Is that making it easier for fire departments and EMS officials to respond across our communities?
Well, sure. I mean, you've been at Orchard and Maple before, and you know the craziness of some of the intersections, and clearly that side of it makes it easier for us. But what's truly the folks that are making this all work are our residents, and they're the ones that are really making that happen, because they are staying at home and they're helping to prevent that disease from being transmitted. I know it doesn't feel that way when you're just kind of bouncing off the walls as we come up on 2 weeks here, but it truly is what is making a huge difference.
Do you have any sense if we are getting to the top of the curve? It seems like we're getting close. I know we hear that this is maybe the worst week ever. They've been saying that nationally. I did see that our numbers are moderating. I think they're moderating a little bit. You're closer to it. What's your sense based on the calls that you're seeing in your department right here on the front line in West Bloomfield?
Well, we're not seeing a change. And I'm concerned, and you're probably closer to the meat side of it. I know that there is always a rush to be first, to be the ones to say, hey, we were the first ones to report that this thing was changing. I'm not comfortable with making that call yet. There is not enough days in a row for us to see any kind of trend. And let's say there was a trend. Let's say we were winning. It's the exact strategies that we have in place right now that will keep us in that winning position. So any move right now, I think, would be way premature. And as you started off with there, I think at the front end of this question is we're bracing for the worst week, And so we stand ready for that. Our crews, as you can see behind me, I'll kind of step to the side here. You'll see a few orange cones. Those orange cones are defining what we're calling a hot zone here in the fire station. And so anytime they're inside of that area, the the crews are going to disinfect their gear. They're going to disinfect their shoes, everything, and then they switch out and go into a different pair of shoes they would actually wear inside of the engine house. Also, to the left of me is a staging area where we put all of our equipment out that's in what we'd call a warm zone. So it is a clean area. And then crews will come around to the back of the fire station. They come in, they pick up their equipment, and then they take it back to one of the other 5 fire stations here in West Bloomfield.
All right, Chief Greg Flynn of the West Bloomfield Fire Department showing us exactly how they're keeping not only us safe and talking about that on calls, but also talking about how he's keeping his own crew safe. I've got to go grocery shopping tonight, so I'm going to get a couple of cones and set them up in my apartment and, put things in an area, maybe out on my deck or somewhere before I get things cleaned off to get things in the house. It's I'm isolated, but getting the groceries in, that's a handful, and we'll talk about that later on in the show. Thank you, Chief, for joining us. I'm going to keep you here for a minute. Our next guest is somebody you know, and he is one of the dispatchers in Troy. That's not why we're going to talk to him, but Matthew Pillsbury joins us on the line. He said that, Chief, that you helped instruct him early in his career. So, Matt, can you hear us?
I can hear you. Good morning, gentlemen.
All right, you can say hello to the Chief. We can't see you, Matt, because you're on the phone, but Greg Flynn is smiling, big ear-to-ear smile, because one of his students is on the line. And, Chief, you're a celebrity. Everywhere I go, people know you.
Everybody knows Chief Flynn.
Nonsense.
All right, well, I know your line's breaking up, Chief. We're going to let you go. Thank you very much for joining us. Joining us right now, Matthew Pillsbury. He is a 911 dispatcher in Troy. We've got him on the air for another reason we'll explain in a minute. But, Matthew, before we get to that, how's it been going in your 911 center in Troy?
On my shift, we've had a lower call volume. I can't speak for the other shifts. I work the midnight side, but I believe people are staying home and keeping to the regulations. We're not seeing a spike in calls. And it seems to be not a lot of people on the road when I go to work, and it's down definitely with us as well.
Well, that's really good news. The reason we do have you on the line today is you're a pilot. You're a member of the Troy-Oakland Pilots Club, which I also happen to be a member of. And and I understand that via a fine gentleman by the name of Cran Jones, a bunch of pilots from our area in Oakland County took off late last week, I think on Friday, flew down to Indiana to get some medical supplies. Tell us the story, if you would.
Yeah, that's correct. So Cran and I have a mutual friend, Nick, who was my initial flight instructor, and Cran has some ties to the auto industry, and he was, everything was coming out about all the pandemic things, and it was getting worse, and Cran didn't want to sit idle, so he called, he's associated with an auto plant in Muncie, Indiana that makes auto parts, and he called his people down there and said, I want to do something. I want to do something to help. I don't know what, but what can we do? And so one of his engineers was off, and he went to his shop in his house and developed a prototype face shield and sent a picture to Cran, and Cran said, I want however many you can make, and when can we get them? And so they went to work, and they retooled their plant and ordered supplies, and the first shipment was 250 masks. One pilot flew down, and or one group of pilots flew down in a single airplane to pick those up a couple weeks ago. And they were such a hit with the local hospitals around here in Metro Detroit that they kept building more and more masks and face shields. And we had enough to pick up 12,000 face shields on Friday with between 4 airplanes.
Isn't that amazing? I mean, just a couple of guys getting together with a friend who manufactures in Indiana and some local pilots able to transport those shields up here almost immediately. And you get some citizens all working together along with that manufacturer and 12,000 face shields helping to protect our health professionals on the front line. I can't think of a more beautiful story right in the middle of all this. That had to really feel good to be a part of that, especially given the fact that you work in the Troy 911 Center and you're with first responders every day who will be helped by this.
Yep, absolutely. I got the call from Nick, and he said, "Hey, can you call me on Wednesday and said Friday we're going to Indiana? Can you get an airplane and help us out?" And I said, "I certainly can." And I checked the schedule at our club, and there was obviously a plane available, and so I flew over to Pontiac, and we all grouped together and flew down as a flight of 4. And I think it was a total round trip of about 4 hours by the time we loaded up and took off from Pontiac, loaded everything up, and dropped them off at Willow Run. So what would have taken a day and a half to 2 days to get those supplies up here, we got up here in under 5 hours.
Every day counts. Matt, thank you very much. I got to run along. We've got the governor's press conference coming up in a minute. We want to get to that. Matt Pillsbury, Troy Oakland Pilots, a member, one of my friends and brothers in the flying club. I'm a pilot as well, so I know how this all works, and very, very cool what you guys did. And count me in for the next flight. I'll join you guys with my plane, and we'll go down, and whenever we need to go pick something up, I'm there. I'm in. All right?
That sounds great. Thanks a lot, Dave.
Matt, thank you very much. There you go. So another great story right here in our area. We're going to take a quick break. We'll be back in a moment. We are waiting to check in on the governor's press conference, which should happen any minute now. Governor is speaking to a number of issues. Don't forget, tomorrow, legislature is going to vote to decide whether to endorse the governor's state of emergency to 70 days. We'll talk about that later in the broadcast. A lot of discussion about that. But we'll be back in a moment. You're listening to and watching the Megacast on WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, 89.3 Lakes FM, and on Civic Center TV, and Bees in the D. We will find out who they are in greater detail later on. They are giving us their Facebook page. We appreciate it. We'll be right back.
Hi, I'm Dr. Jonae Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
All right, welcome back. This is the Megacast on 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio. Today we are also on, as we are every day, on Civic Center TV. You can watch that on Comcast Cable Channel 15 if you are in the correct communities in the West Bloomfield area. We are working on, and we got the okay Friday, to add the Bloomfield and Birmingham television channels. We'll add those as soon as we can get the technology coordinated, hopefully today for tomorrow's broadcast. So we're working on that. You can always watch us, though, online. Easy way to watch so you can see all the video. If you're listening on the radio and you want to see what's going on, it's all on civiccentertv.com. I'm Dave Scott. The other side of the studio is our own Tyler Keefe, who's always busy at the beginning of the show getting everything connected. Here is the signal that we are getting, and we're not hearing anything, but there is a signal that we're getting from the Michigan State Police for the governor's press conference. We're going to watch that real close. We had trouble getting her press conference on the other day, and a bunch of media outlets, including ourselves, missed the first minute or two. We will keep an eye on that, see how things go. And Tyler, I know you're keeping an eye on all the other outlets and pages. Oh, there we go. We see the governor right now. So let's jump to that and see. We'll leave our audio up here. I assume we have that audio up. I don't know. I just want to double check if you're watching online. I think we do. So we should hear the audio coming through any minute. It's really funny because you're probably seeing it online. The Michigan State Police and their stream are doing the same thing we're doing. They're just doing it all right on their computer screen. So it's a little crazy, but it's all going to happen. So while we're waiting for the governor, stories that we're watching today other than what the governor is going to talk about, there's a new panel called the Michigan Economic Recovery Council. The Michigan Economic Recovery Council, and they are a group that will be advising the governor on how and when to return to work. She's getting input from them. Might hear from her on that today. I expect we're also going to hear from the governor today on what's going on in the legislature. They are scheduled to return to Lansing. It was very difficult to put all the details together to get your lawmakers in and out of the Capitol in a safe way. They're doing it tomorrow, and they need to vote on the governor's extension. But she's speaking. We're going to just get out of the way. The governor of the state of Michigan.
I'm joined by, of course, Dr. Janae Caldoun, our chief medical executive. Since Thursday, I signed an executive order that prohibits all employers from retaliating against an employee for staying home from work if they or one of their close contacts has tested positive for COVID-19 or has symptoms of the disease. The order also strengthens the Stay Home, Stay Safe executive order by declaring that all Michiganders who test positive or show symptoms or who live with someone who tests positive or shows symptoms should not leave their homes unless absolutely necessary. And we saw leaders from the Detroit Pistons, the Lions, the Tigers, and the Red Wings come together to ask health professionals from across the country to come to Michigan to help us fight COVID-19. We are running dangerously low on PPE. At Beaumont Hospital, we have less than 3 days until N95 masks run out. At Henry Ford Health System, we have less than 4 days. And at the Detroit Medical Center, less than 10 days. At all three health systems, there are less than 3 days until face shields run out, and less than 6 days until surgical gowns run out. Now, this data does not include private donations that are going straight to hospitals, for which we are incredibly grateful. I think it's important to note that while these timelines are very serious, they are a vast improvement from where we were just a week ago when we were living more like day to day. But I highlight them because we must continue to do more. We are doing everything that we can at the state level to secure more personal protection equipment. Today, we will begin distributing 1.2 million surgical masks that the state has procured on the open market. And FEMA has sent to Michigan 400 ventilators, 1.1 million surgical masks, 232,000 face shields, and 2 million gloves. We're grateful too that FEMA will be shipping 1 million more N95 masks to Wayne, Oakland, and Macomb counties this week. I spoke with Vice President Pence both on Saturday morning and on Sunday morning, and we are grateful and continue to work with FEMA and the Army Corps of Engineers, as well as the Michigan National Guard, to get TCF Center up and running to see patients by Friday. Ford and the United Auto Workers have already donated thousands of face shields to Michigan hospitals. And yesterday, the state issued a purchase of 1 million face shields from Ford over the next 3 weeks. We're making some progress, and that is a good thing, but we need more PPE to continue fighting this virus. While fighting COVID-19, we've seen an unprecedented rise in unemployment claims. When this first started a month ago, I took steps to expand benefits for Michiganders who are out of work because of COVID-19 and ease rules to make it easier to apply for unemployment. Now, the high volume that we have seen outpaces any, even in the toughest week during the Great Recession. The hardest week during the Great Recession, for perspective, was 77,000 claims. 2 weeks prior to COVID-19 first presenting in Michigan, we were averaging around 5,000 claims for a week. Now, just for perspective, to know that that's what it was, and now, since COVID-19, the week of March 15th through the 21st, there were 127,000 new claims. It was 5, and now it's 127,000. The week of March 22nd through 28th, it was 300,000 new claims. These numbers are staggering, and they will continue to climb. We've had almost as many people in one day file for unemployment as any of the longest week of the Great Recession. Many people have applied in 2 weeks. More people have applied in 2 weeks than all of 2019. Accordingly, we've been completely inundated in our UIA system. We are continuing to work to redouble our efforts, quadruple our efforts actually, working with DTMB around the clock to increase our website capacity. For 1099 employees and workers, for independent contractors and gig economy workers, the additional $600 per week that we are hoping to be able to include, we are still waiting on the U.S. Department of Labor to give us the rules and authorization to pay. I just want to say I understand how frustrating this can be. I've talked to a number of people who've been trying to navigate the unemployment system. I know that there are 800,000 claims, and I want you to know we will get to you. This is hard, but we cannot proceed until we've got the guidance from the federal government and until we have the ability to get everyone into the queue. I'm going to be dedicated some of my time this week to help with that effort personally. And I invite anyone who would like to chip in and put their time into it to join me. I'll continue to update Michiganders on where we are with unemployment benefits as we navigate these times. And please know I have done a lot to cut red tape and make it easier to apply for unemployment, whether it is eliminating the paperwork that used to be required, or it is alleviating the date certain for which to accrue benefits. Those things will not hold you back. We will help you get the unemployment that you deserve and that you need. So I want to give you an update on COVID-19 cases. It's been just under 1 month since we saw the first cases of COVID-19 in Michigan. Since we announced those first 2 cases on March 10th, our case numbers have jumped to 15,718 as of Thursday. And as of today, or as of yesterday at the same time, 617 people have died from COVID-19. As of today, nearly 80% of the positive COVID-19 cases are in Wayne, Oakland, and Macomb counties. The population lives in the same area. This virus moves easily from person to person, especially in areas with higher density. COVID-19 does not contain itself to city limit, to county line, or to state line. When the question is about what's happening in Michigan or what's happening in Detroit, it's really about the region where we have the most populated density. While we still don't have enough tests, we will continue and have continued to do more testing. Even if you don't feel sick, I want to make sure people remember you can be carrying this virus. Dr. Fauci, I think, said that they anticipate up to 50% of the people with COVID-19 might not even know that they're carrying it right now. Just one person who is carrying COVID-19 can infect 40 people in a day, who in turn go on to affect thousands. And that's why every one of us has to do our part. Every one of us has to do it for the loved one that we're worried about, the grandparent in a nursing home, the child or siblings on the front lines at a nearby hospital, the coworker who helps you get through the long days, who's at higher risk because they have a chronic illness, or the neighbor who works at the checkout at the grocery store or at the pharmacy. It's on every one of us to do our part to protect them. And now I want to talk about masks. The executive order I signed on Friday also states that when symptomatic people or their close contacts leave their home, they wear some form of covering over their mouth, such as a homemade mask, a scarf, a bandana, or a handkerchief. This is a Detroit Tiger mask that someone generously sent to me. I encourage everyone to wear some sort of a face covering on those few trips that you need to leave the house. During this time, it's crucial that you only leave your home when absolutely necessary, like going to the grocery store or picking up a prescription. Limit those trips. Make them quick and limited to precisely what you need, and return to your homes. When you must leave, Dr. Khaldun and the CDC are recommending that you wear a mask. Because there's a shortage of N95 and surgical masks, we ask that you wear one like this so that those critical masks are left for the people on the front line trying to take care of the sick. Let me be clear though, wearing a mask does not mean that you are immune and that you don't need to observe all of the other CDC guidelines. You still need to stay 6 feet away from people when you're out in public, washing your hands, coughing into or sneezing into get the crook of your arm. It's crucial that just wearing a mask doesn't give you a false sense of security and you think that you can resume normal life. It's just an added protection. Michiganders must still stay home and stay safe in order for us to slow the spread. I've been asking people to post how they're doing and what they're doing and how they're doing their part during this crisis. Thousands of people have contributed. People are using their time to clean up their local parks or finding fun activities to do at home while they're with their kids. Some have given blood by going online and scheduling a trip to the Red Cross. And so many people have sent photos of their homemade masks that they've made for themselves or nursing home residents or for healthcare professionals. We're grateful for that. And making a homemade mask is simple. If you're not creative like me, there are no sew options online. Or if you are creative, you can make a really nice one like the one that my friend gave me. I encourage you to take the time to educate yourself and then to post it with hashtag doing my part. This is an unprecedented time in our history, and we've got to do everything we can to help each other get through it. We will get through this. We've heard stories from people across the state who hold on to the little things to help them cope. Healthcare professionals like Lori, who is a nurse at St. Mary Mercy in Livonia, who sings Amazing Grace to her patients. Or Katie, a nurse at Sparrow Hospital, who uses dry erase markers to draw pictures on her face shield. Or the 8th grade math teacher who writes problems on students' driveways in chalk as they go for their jog. Or Colleen from Hamtramck, who created a theater where she performs from her balcony and streams on social media to share laughter with people. Or these two heroes. These are relatives of people who work on my staff. This is Gita Dagger's sister, Dr. Batul Dagger, and Ron Owens' mom, Fashtana Irwin. They are on the front lines, and we're highlighting them because we're amazed by their incredible dedication to doing this. As we continue navigating this crisis, I'm proud to live in a state where we're doing everything we can to limit the spread of COVID-19. The New York Times released this graphic in the last couple of weeks, or in the last couple of days, and it shows where in America people are complying with stay-at-home orders. And I think it's important to look at Michigan. Michiganders are taking this seriously. A lot of people in the Great Lakes area are. The vast majority of us are staying home and staying safe. And also, according to the New York Times, the rate of cases slowing in 10 of 10 Michigan's most active counties. Several hospitals are reporting that discharges of patients are picking up. It does not mean the number is going down, but it does mean that we're slowing the rate of increase. That's why we all have to continue doing our part and being aggressive. I've also received data that confirms that Michiganders are traveling less for retail, recreation, groceries, trips to the pharmacy, and work. We're traveling less than our neighbors in Illinois, Indiana, and Ohio. And this is good, but we must keep it up. We must encourage our friends in other states to take this seriously as well. If you know someone in a state that hasn't been as aggressive as we, encourage them to be so by calling them. Even if their leaders aren't being as aggressive, they can still do their part to keep themselves and their family members safe. Most of us know and have loved ones in other states. I know that. My dad is a snowbird who is still in Florida, and he's got compromised lung function, and I'm worried about him. So I keep calling and harassing him, and I hope that you all do that with your loved ones as well. Because this isn't just Michigan's fight. To get through this, we have to be united as a country against this virus. It doesn't discriminate between state lines, and it doesn't discriminate between party lines. Every one of us is susceptible, and we must fight this virus together. We are still looking for volunteers at our website, michigan.gov/fightcovid19. If you're a hospital professional or a healthcare professional that can provide your expertise at a nearby sign up. If you're someone who can donate to your local food bank, donate blood, or help manufacture medical supplies, I urge you to reach out. If you're an employer in Michigan who has healthcare people on your team, and you want to encourage them to sign up, and you will help them through this by continuing to pay their salary, like some of our employers have, I urge you to do that as well. And we will get through this together. I thank you for the hard work that you've done. I thank you for the sacrifice that you made. I know that every one of us is making a sacrifice, and it does not come easily, but is incredibly important to the health of our state, the health of our people, and the health of our economy in the long run. With that, I'll turn over to Dr. Janae Caldoun for a few comments as well.
Thank you, Governor. The next several weeks are going to be very challenging as we fight COVID-19 here in Michigan. We continue to see more than 1,000 cases daily in the state, 1,000 new cases. As of yesterday, as the governor mentioned, Michigan had 15,718 cases and 617 deaths. Based on our preliminary data, we see that it appears to be impacting minority populations greater, with 33% of cases and 40% of deaths being in African Americans. We do not fully understand the scope of how COVID-19 is impacting every community, and we will continue to track and analyze this data. That will be incredibly important. But what we do know is that every Michigander, regardless of their race, regardless of where they live, must have the resources and tools available to be able to fight this disease. We're working very closely with community leaders to make sure we are doing everything we can to support those efforts. We're also expanding testing across the state. Testing capacity has grown significantly even in the past 10 days. On March 25th, Michigan reported about 9,000 cumulative tests for coronavirus. 10 days later, on April 4th, we reported over 40,000 cumulative tests. At least 15 laboratories in the state are now able to run these tests, as opposed to one about a month ago, our state laboratory. We've also learned that several Michigan hospitals, as well as the city of Detroit, will receive rapid testing supplies from Abbott Laboratories, which produces a result in 15 minutes or less. We will continue to make testing a priority and more easily accessible for Michiganders and simpler for our medical providers who want to provide this test for their patients. We know, as the governor mentioned, we are not out of the woods yet. Our hospitals continue to be overwhelmed, particularly in Southeast Michigan. Every day, we ask all 173 acute care hospitals to share data with us on the patients they are taking care of who have COVID-19. The data is still incomplete, but based on the information we have received, on April 4th, there were at least 3,768 patients hospitalized for COVID-19 across the state. 1,383 of those were on ventilators. 89% of those hospitalized were in Southeast Michigan. We're working incredibly hard to make sure hospitals get the support they need: equipment, ventilators, masks, gowns, and medications. We're also working around the clock to ready additional alternate care sites like the TCF Center in Detroit, and we expect this facility to be ready to start seeing patients later this week. While we work to expand testing and make sure our hospitals are supported, I can't stress enough the most important thing to do is heed the governor's stay home, stay safe order. Do not go out of your home unless it is absolutely necessary to get food, medicine, or to do critical infrastructure work. And if you must go out, you should wear a mask to protect yourself and others. We're asking people to join the My Mask Challenge. Make a mask from a cloth or bandana and wear one every time you go out. Just remember that we have to leave the surgical mask and the N95 mask for our frontline healthcare workers. COVID-19 is incredibly serious. It's infecting and it's killing people across the state of all ages. No one is immune and there is no treatment. I implore all of us to remain vigilant and to stay home as much as possible to do your part to fight this disease. And I'll turn it back over to you, Governor.
All right, thanks, Dr. Khaldun. With that, happy to open it up.
We're listening to the governor's press conference from Lansing. We're going to hear from
Governor, do you
reporter
plan to
questions.
extend the stay home, stay safe order?
So we are looking at an additional order with regard to staying home and staying safe. We know that people are taking it seriously, and I think that that's a good thing. I think that to see the real benefits of the work that we've done, it takes a few weeks to know what that really means. But we do know that the most effective tool that we have right now, as our hospitals are overwhelmed and we don't have enough PPE, is to slow the spread of the virus. And that's precisely why we did the stay home order as early as we did. We were aggressive. We we were on the front edge of setting that policy. We are not close to the apex yet. We haven't hit that yet, and until we do, I think it's absolutely essential that we're continuing to be aggressive. So I would anticipate an additional order probably in the next week, and that you'll have more information on that, so stay tuned.
What do you plan to do if your request to extend the state of emergency is shot down tomorrow, or if it's only approved for a short time?
Well, the action tomorrow by the legislature is really only to extend it by 1 day. So I think that's what is creating so much consternation amongst legislators. When I issued the emergency order and also the disaster declaration, that actually started a 28-day clock. If they take action that's less than what they're talking about in the press, it's really only a 1-day extension, and it doesn't make a whole lot of sense to come in just to extend for 1 day. Now, if they're coming in, I hope that they will seriously look at going 70 days, because I would hate for them to have to come back at the height of the crisis that we're confronting. These are legislators that come from all parts of our state. So to congregate and then go back to all parts of our state is contrary to all of the best medical advice that we're getting from epidemiologists. I recognize and value the work of the legislature, but I am concerned about their health. And I do know that another legislator today was found to be positive for COVID-19, and it's precisely why, in the wake of Representative Robinson's passing, that I'm very concerned about any efforts to come back more than actually necessary.
And just
Governor, over the weekend there was a reboot, an update on the system for unemployment. Do you have any sense if that is going to have a positive influence on getting some more of those unemployment benefits filed more quickly?
Yeah, I mean, that's the goal, Rick. You know, I highlighted in my comments the incredible surge on the unemployment system, even in the height of the Great Recession. It dwarfed anything that we're seeing right now. And that's precisely why I thought it was really important to go from 20 weeks to 26 weeks unilaterally, giving people another month of unemployment because of the executive order that I issued. I'm grateful for the work that's happening on the federal level. Gary Peters has been a big part of that. But what we need to do is make sure everyone gets an opportunity to file. There's no penalty for not filing by a date certain. I changed that. I cut the red tape so that it's going to be easier for folks to actually get the unemployment. But navigating the system's a challenge, and I share and feel the frustration that people are having. They're anxious, and that's understandable. I just know that we are rebuilding the system. We are doubling and then quadrupling the number of people that are helping at the agency, so that we're able to get everyone signed up.
Governor, thank you. Aside from your role as head of government, I'm wondering if you could speak personally about how this has affected you and how you can relate to the millions of Michiganders who are looking to you not only for leadership, but to try and understand where the light is at the end of the tunnel and how to cope with this.
Yeah, so I appreciate the question. Like everyone, this is a challenging time. And You know, I see it in my kids' eyes and in my husband's eyes as they're all trying to figure out what is the right thing to do. How do we navigate this? When will life ever get back to normal? Are we going to be okay? And we don't have the added pressures that I know a lot of Michiganders do about how are they going to, you know, keep a roof over their heads. And so I am reminded every day how great the sacrifices that so many people are making right now. I am always searching for sources of inspiration, and I see it in the people that we've highlighted today and the people on the front line who are putting their own lives at risk to take care of others. And I think that, you know, the thing I know about Michigan and the thing I know about the United States of America is that we are tough. We will get through this, and ultimately, everyone doing their part is what's going to be necessary for our ability to navigate that at the quickest possible time. So that's, you know, it's hard. And being at home and not being able to get out and to be with friends and family is hard. From the Queen of England, who mentioned it yesterday, to real people just trying to get by day to day. We're all confronting this, and we're going to get through it together.
Governor, can you respond to Beaumont's complaints about lack of accurate and available data to manage hospital load balancing?
Sure. We know that Beaumont Health System has been inundated. They were the first to get to capacity, and they and every hospital is required to be submitting data to the Department of Health and Human Services. Beaumont actually has done a really good job in complying with that. We're working closely with others to ensure that we've got accurate data and that the reporting is up to date. We've always, you know, we've got a ways to go, but I will acknowledge that FEMA has praised the state for getting them better data than some other states so that they can make decisions. And so we're doing some things well. We've got incredible challenges. None of us has ever been in a situation like this. But I recognize that there's incredible work that's being done, and we'll continue to lead on that front.
That said, on Sunday, 58% of hospitals were reporting PPE, and that doesn't really provide an accurate picture of, you know, what we have statewide. What's the plan for hospitals that don't comply?
I'm going to ask Dr. J to step in as the Chief Medical Executive.
So you're absolutely right. We want to be as comprehensive and transparent as we possibly can, and accurate, quite frankly, when it comes to our reporting. We've come a long way. As you mentioned, PPE is on our website. We've got beds available, tracking that. We are one of the only states, actually, in the country who's reporting data by race and ethnicity. We've got cumulative tests on the website as well. We have to do more, and we're working closely with the Michigan Hospital Association to make sure our hospital CEOs know and have the ability to report appropriately. We're going to be looking over the next several days as far as what additional data we can get out there. It is incredibly important to be transparent and complete.
Governor, do you believe that the precautions that are being taken in the state legislature tomorrow will be enough, or do you think that holding session is a health danger?
Well, you know, I think that any grouping of people that are coming from different parts of the state and then returning to different parts of the state is concerning, and that's precisely why the stay-home order is so important. I'm not going, you know, I don't run the legislature. The Speaker of the House runs the House, and the Senate Majority Leader runs the Senate. I've made sure that they understand how serious the situation is and what my thoughts were, but ultimately that's their determination. What steps they've taken, I can't weigh in on, as I'm not familiar with all of the precautions that they've taken. I just know this: the more people that are out and about moving, the more likely there's spread. And because of that, and because of what our epidemiologists and all of our healthcare experts are telling us, we know that coming in for a one-day extension probably isn't the wisest thing to do, and coming back in a few weeks will probably be when we're close to the apex and the height of this crisis, and it would be contrary to all medical advice. So if they are coming in tomorrow, I would hope that they extend the state of emergency for longer so they don't have to come back in the height of when the crisis is really hitting Michigan.
Governor, I appreciate that your focus is on health, the health of people in Michigan, hospital care, all of the things that you've outlined. But at the same time that this is happening, the state is seeing a big hit on revenue, even as legislators are meeting by Zoom trying to put together a budget based on your recommendations. How big of a problem do you anticipate this being, and how concerned are you about that?
It's going to be immense, and I'm very concerned about it. I know that the worst thing we can do for our economy, though, is to have a porous set of policies that mean that we're confronting this crisis longer and having more people lose their lives from it and devastating our healthcare system even more than it already is going to be. That's precisely why we've got to be aggressive. It's much better to have an aggressive initial action than to just have things peter on for a longer period of time where more people get sick, more people die, and our economy can't get back to normal for a longer period of time. And so I think that's precisely why, as people have studied the issue and understand the incredible cost that we're confronting, realize that being aggressive is actually the best thing for our economy, and that's precisely what we're doing. It is going to have an impact, though. We're going to have to make some tough decisions around the state budget. We're going to have to make tough decisions as people are going to have to make tough decisions in their personal lives and in their businesses. We are all going to be confronting these challenges, and yet there's no choice other than to be as aggressive as we can now to mitigate the extent of the problem on the other side.
Governor, you showed that New York Times map and how well Michiganders were doing relative to many other places in the country, and yet the caseload continues to grow. And as you said, it's not a matter of the numbers diminishing, it's just growing a little less slowly. So people might hear that and feel discouraged that we've been doing everything right, and yet this thing continues to get worse. Do you get concerned at any point about a sense of exasperation setting in and people just throwing up their hands and saying, you know what, we've been doing everything they've been telling us to do, and there's still no sign of this getting any better? How much worse could it get? Is it time to just go back to normal?
Well, of course. I think anyone who gets asked that question, I would think across the country would have to say, yes, of course, we're concerned about that. But the fact of the matter is, COVID-19's been spreading in our state for a lot longer than we ever detected it. We've never had enough tests. We still don't have enough to do robust testing to be able to articulate precisely who has it and who doesn't have it. 2 people in a household who are both in their 30s and very healthy can have COVID-19. One can experience a slight fever and feeling a little bit like the flu. For the other, it can be fatal. And I think that's precisely the message I hope that people are paying attention and understanding here. We don't know how our bodies are going to react to COVID-19. We know that if you're elderly, you could possibly have a tougher time with COVID-19. We know that if you have a pre-existing condition like asthma, like one of my children does, or COPD, like another family member does, that it's going to be harder for you to deal with COVID-19. But there are people out there who are healthy and are carrying COVID-19 and don't even know it. There are others who might get COVID-19 and it will be fatal for them. And that's precisely why we've got to continue to take this incredibly seriously. With this comes a lot of sacrifice. We know that, and it's not easy, some of the actions that we've had to take. They all weigh heavily, every decision that I've made. But I can tell you, when you listen to the health experts and the epidemiologists, there's no question that saving lives, mitigating the pressure on our healthcare system that is already stressed, and watching, after some time goes by to see really what a difference it's made, takes dedication, it takes grit, it takes fortitude, and ultimately I think we're going to find that a lot of these actions really contributed to a better outcome. It's going to be hard to be grateful for the outcome no matter what it is, because it's already been tough. But the fact of the matter is, each of these actions has been really important to support the nurses and the doctors and everyone on the front line, as well as the health of the people of our state and the long-term economic outlook of our state.
Dr. Khaldun, you mentioned that the field hospital at the TCF Center will open for patients later this week. Do we have enough doctors and physicians and respiratory therapists and nurses to be able to staff that? And if not, where are we going to get those medical workers?
Right, so we believe at the end of this week we'll be able to start seeing patients at the TCF Center. It doesn't mean we'll immediately see 1,000 patients, but we will have enough staff to start seeing patients as they're transferred from other hospitals. We still need medical volunteers. There's no question about that for the TCF Center and other centers that we will need to stand up. So we're still asking medical volunteers to go to our website, www.michigan.gov/fightcovid19 to sign up.
And is FEMA available to provide any kind of staffing assistance for that center or any field hospital?
FEMA has been very supportive of us when it comes to staffing and supplies and building out the facility. But we still will need, there's no question we need volunteers. We're working with national staffing agencies to bring in nurses and doctors, and we're still going to be needing that over the next several weeks.
Is Michigan participating in Governor Newsom's state consortium so states don't have to bid against each other?
So we've actually had a consortium that we've been working with Wisconsin, Minnesota, and Illinois for a while on, actually. So I was glad to see that other states are pursuing working together and increasing their buying capacity, but we've been doing that here in the Midwest for a while. And it's been beneficial, and we've also been sharing our best practices and referring additional vendors. So we've been working together as geography for a bit.
Governor, perhaps for you, Doctor, one of the questions that's frequently asked to us is, what about people who have recovered? People who have been diagnosed, hospitalized, non-hospitalized. Do we have any database on that? Do we know how many people have beaten the virus, and is there any value in keeping that kind of information?
Absolutely. So we will actually later this week be able to start posting data on the number of people who have recovered in the state. I will say, as the governor mentioned, it's been less than a month since we identified the first cases, and so it takes time for someone to have recovered. So we have to go back 30 days, see who's doing well, not in the hospital, hopefully have not passed away, but we believe we'll be able to start posting that data very soon.
And it is very important. I mean, to your question, we want to know who possibly has antibodies, right? Who can be safely out in the public or back to work. I think it's also going to be important that we continue to work on an antibody test that is available in a robust way. There are a lot of people that may have had COVID-19 and didn't have dramatic impacts enough that they needed a test to confirm that they'd had it. But we want to confirm if they did and to know that they've got antibodies. You can't take the COVID-19 test to determine if you have COVID-19 later to determine if you had it. And that's why the antibody test is really important. And so we are working on that front as well. We want to build that kind of a database so we know who among us has got those antibodies. But even if you can identify all of them, and you're the doctor, so correct me if I'm going too far out here, but even if you can identify all of them, it doesn't necessarily mean you know how long they will have their immunity because of the novel aspect of the virus.
That's right, and we don't know if the virus is going to mutate. So even if you have the antibody, how effective is that antibody in fighting the disease, and will you be immune next year if the coronavirus is still around? So all of that still has to be studied.
Governor, given the president's remark recently that for governors to receive assistance
Dr.
from him, they'd better be nice to him.
Are you there?
There may be some people concerned about
right now. I
could be
see that
perceived
you're
as political
muted.
tit for tats, but you've mentioned
Hey,
a number of times.
It's Malhotra. How are you?
Malhotra.
Oh, stand by. We've got a little audio interruption here. We're going to try to fix that. Tyler's going to play a quick 30-second commercial, public service announcement, and we'll be right back with the governor's press conference.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives. Hi, I'm Dr. Jonay Caldoun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
All right, welcome back here. We are going back to the press, the governor's press conference. Sorry about the audio interruption.
Party line or state line or any other divide for that matter. And so I do think that, while people like to focus on that other stuff, we're not. We just keep rolling up our sleeves and working with anyone who will help. I think that also the vice president, having been a governor, that is something, a perspective I think that has been really useful in terms of kind of getting down to the nitty-gritty of what we as state leaders need.
Federal health officials said over the weekend that they're predicting the peak of cases will likely come in about a week, and you've been saying that this is going to happen in late April or early May. What is the reason for that difference, and what models are you looking at to inform your decisions, and have you been seeing changes in those models?
So a couple things, and then of course Dr. Caldoun will probably step in and share some thoughts as well. But first and foremost, we've never had enough tests to have the kind of robust testing so that we've got data that we can feel informs a model that is reliable. That's just a fact, and that's not unique to Michigan. That's a kind of a countrywide issue that we've all got. Number two, when the federal modeling looks at what's happening in terms of when the peak is, they can articulate an average or a general, but we're gonna have peaks in different parts of Michigan at different times. And so the modeling that we're looking at is done by people here in Michigan at the University of Michigan. It is, of course, not perfect because of the testing issues and the data collection, but that is what we're working off of, and we anticipate that the peak is end of April, beginning of May at this juncture, which is, a handful of weeks out.
That's right. Our model is looking at Michigan-specific data. We're working with the University of Michigan. Our model is getting more and more accurate, we believe. But again, anyone who says they know the specific date where it's going to peak, I just don't believe that's true at this point. But as we get more testing, we'll be able to get more precise with our modeling.
All right. Thanks.
All right, well, there you have it, Governor's press conference from Lansing, and an awful lot from the governor today. Standing by, we'll get to him in just a minute, is the chief medical officer at Henry Ford Hospital, West Bloomfield, Dr. Manu Malhotra, and we'll get his feedback, and I'm not sure if he was able to hear the governor's press conference. We'll talk about what's going on the front line a little bit closer to home at Henry Ford Hospital, West Bloomfield, the Henry Ford Health System, and how we're doing here in southeastern Michigan. So again, very quickly, the governor today says there will be no retaliation against employees who stay home during this crisis. She talked about the unemployment claims and the fact that we usually would have 5,000 in a week. The week of March 27th, over 300,000. We know the people are having difficulty filing unemployment online. States waiting for the additional 600 per week from the federal government, and they did reboot their systems over the week, but they're continuing to recommend that you file during off hours. Dr. Janae Caldoun from the state also talking about the Abbott Labs 15-minute tests that we're seeing here in Metro Detroit now, and also saying that 85% of the Michigan patients statewide, 85% of them are right here in southeastern Michigan. And then right at the end of the conference, I heard the governor said that peak expected late April, early May. We're going to digest all that for 30 seconds, hit a couple of buttons, and then we'll be back with one of our top medical professionals right here in southeastern Michigan and in Oakland County when we return. This is the coronavirus special Megacast broadcast. My name is Dave Scott. Tyler Keefe in our studio. We thank all of our stations. We'll recognize you in a moment. We'll be right back.
Hi, I'm Dr. Janae Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
All right, welcome back to the Megacast. Dave, Scott, Tyler Keefe here on radio stations all over the Oakland County and southeastern Michigan area. Also on CivicCenterTV.com. And we are on the Bees in the D Facebook page, too. Doesn't get any bigger than that, Tyler. That is a big, they have over 8,000 followers.
They have a great following, and they have great partners, too, including our very own friends over at West Bloomfield Parks.
We're going to talk to the West Bloomfield and the Troy Parks and Recreation, actually the Auburn Hills Parks and Recreation Department in just a couple of minutes. But patiently waiting for us is Dr. Manu Malhotra from the Henry Ford Hospital. He is the chief medical officer at Henry Ford West Bloomfield Hospital. And I think I can punch him up here in just a minute. It's a lot of buttons to hit here, Doctor. There we go. We have you on our screen via Zoom. Thank you for joining us today in the Megacast. And how you feeling?
Good. Thanks for having me.
Well, thank you. I'm glad you're doing well. You know, I hope your heart is warmed as ours has been by the outpouring of public support for all of you on the front line.
Oh, absolutely. I think that that's meant the world to the people who are on the front lines, really taking the risk every day to make sure that they keep our communities safe. I'll remind you, these are the same people that take some degree of risk every day and have been doing so for years. It's really great to see the community really come out and recognize these people. They really do.
And just one other thing, I was talking earlier to a pilot who is a group of pilots here in Oakland County who went down to Indiana, found a manufacturer down there to create face shields. They manufactured a bunch of them and brought them up. I don't know if they ended up in your hospital, but they ended up in hospitals here in Oakland County. That's just one of a ton of efforts that are going on, the people in the community to do all they can to support the amazing work that you folks are doing.
Yeah, I think it's something that I really hope will sort of have an echo even after this crisis is over. Just seeing communities come together and think of ourselves as being on the same team. I think that's something that we haven't seen enough of lately, and I'd love to see that continue.
Dr. Malhotra, how are we doing at Henry Ford West Bloomfield?
There's a lot of ways to answer that question. From the perspective of our communities, we've got quite a number of cases of positive coronavirus in our community. That puts a strain on all of the hospitals in the Detroit and Tri-County area. But currently we are able to manage the volumes that we have. We have plans for additional surge capacity so that we can continue to serve our communities as these needs continue to pile up. We're partnering with hospitals outside of this area to make sure that we have contingency plans if needed. I think one topic that's on everybody's mind is PPE, and currently we're in good shape, but this is an ongoing concern that we have to keep in mind because the burn rate for PPE is unprecedented. Supply lines were not designed for this sort of sustained usage, and most of us spend most of our waking and sleeping hours thinking about how to make sure that we keep our team members, our patients, and our communities at large absolutely safe as we're going through this.
All right, I'm sure by now, we didn't last week or the week before, but I'm sure, Doctor, most people now know PPD is personal protection devices. And that's a lot of different things. That's the masks we were talking about. That's the face masks that you guys are wearing, I think the N95s and others. Are there certain aspects of that supply that are, it's good to hear, by the way, that you're, at least for the extreme short term, at your facility, you're okay. But the governor said like 3 to 4 days. Is your supply a little bit better than that?
I think it really varies by which piece of equipment and supply that you're speaking about. But in general, I would say yes. But that is an active and dynamic situation day to day. As I said, normal supply lines don't keep up with this. So we have basically a 24/7 view of vetting new sources, um, new producers, new suppliers that we have or have not used previously. It's an ongoing effort to make sure that we're able to pull in as much personal protective equipment as possible. And really, I have to say that it varies day by day.
Joining us via Zoom from Henry Ford Hospital, West Bloomfield, is Dr. Manu Malhotra. Doctor, I really appreciate, I know how busy you are, I really appreciate you taking time to be with us today. We heard during the governor's news conference also that these Abbott Lab tests that give results in 15 minutes, some of them are here. Are you seeing those? Is that something that would eventually make its way to our local hospitals?
Yeah, I think that getting faster and faster turnaround testing is something that we will expect to see. Now, Henry Ford Health System has been doing internal testing now for a couple of weeks. So turnaround times that were 5, 7, 8 days have been shaved down to less than 24 hours in many cases. It really ends up being a question of processing capacity. The actual test turnaround time, the processing time itself, is only on the order of a couple of hours. But if you have too many tests, you end up building a queue. So having shorter test time helps, but expanding testing capacity helps also. So I think we'll continue to see shortening turnaround time.
So Governor said earlier today, maybe the peak is coming at the end of April, maybe early May. I know this is only conjecture, but do you have any thoughts on where you think we are and when we might see things turn to the better?
I don't think I would offer any conflicting view on that. I will tell you that I'm optimistic in almost every other moment of my life, but as a chief medical officer, it is my job to be absolutely pessimistic and consider every possible contingency of what could go wrong. So we are preparing ourselves as if this will continue for the foreseeable future. I believe that there are some early signs that there may be a light at the end of the tunnel. I'd be very happy to hear that and see that come true. But currently, I'm completely focused on making sure that we have contingency plans that address one worst case scenario and then the worst case scenario that's even worse than that. So
the great thing is we're beginning to hear from people now, more and more people who have survived, local people that have survived, and we're beginning to hear some of their stories. And it's kind of a mixed bag, Doctor. I mean, in one hand, you're really glad they have survived and they came through it on the back end, and that's reassuring. On the other hand, what these patients are going through with this illness is opening our eyes, and it sounds like it's very, very aggressive. Do you have any thoughts on that?
It is very aggressive, and I think that the first week and a half of this illness really hitting our community was, I think, very eye-opening for people, as opposed to many respiratory infections that may turn around in a few days. People that are getting admitted are pretty ill, and only now that we're sort of into the last couple of weeks, we've started seeing patients getting discharged, patients coming off the ventilators, which is just really, really encouraging news, because I think all you hear about is what a bad prognosis some of these situations have. But we really started celebrating some of those real victories with patients who are very critically ill, now off the ventilators.
Doctor, I'm really glad you took a moment to say that. Thank you, because you probably, like most of America, watched the press conference over the weekend, the national press conferences, and we could spend hours talking about those. But the president said, well, when people get on ventilators, the prognosis is very dark. It's good to hear you talk about people recovering. Do you have anything you want to add to that?
I think the only thing I would say is never in the history of medicine has it ever been good news for your prognosis if you have to be on a ventilator. It's always a pretty dire situation if you need the machine to perform the work of breathing for you. However, people do get off of that, and certainly at our hospital, we've had several people who've come off the ventilator just for this past weekend.
Well, it gives you time to work on finding a way, a path out for them. So I, like you, I want to remain optimistic and as bright as we can during these challenging times. What do you have for the public today? Anything you'd like to share, something that where we can help or something we should know, just any general information as the Chief Medical Officer at Henry Ford West Bloomfield you'd like to share with the public?
Well, I think the first thing I would say is the social distancing, it does seem to be showing some signs of working. And let's stick with that as a community and really try to come through this on the other side with as few cases as possible. Be kind to each other. This is a very tough time, especially for people who are living alone. They may need help. They may just need you to reach out to them. This is everybody's scared. Everybody's tense. Be kinder to each other than you think is necessary.
So preparing for today's show, thank you, by the way. Thank you. Great advice, great words. I appreciate it. I'm going to let you go because I know you have a lot to do, but in preparing for today's show, I called a potential guest who told me they were riding their bike over the weekend and broke their collarbone. And with the hospitals the way they are, and physicians being as busy as they are keeping people alive, it's been difficult to get care. They're okay. They got the care they needed, but it was a little bit more of a challenge. What about the rest of us? I'm glad we're staying home because fewer people are getting hurt. But do you have any advice, thoughts for people that might have some other ailment other than the coronavirus that may require hospitalization or some kind of care?
Yes, we're still providing care for all the other conditions that require it. So obviously the business of healthcare is not shut down, although much of it is postponed for elective, non-emergent, non-time sensitive cases. So if you have a serious injury or an illness, you should either reach out to your doctor's office. There's a lot of options for that. For people whose offices are now closed, many are doing video visits. I know that through henryford.com, you can do virtual visits that actually can be video visits where you're actually seeing your doctor. You can contact them via a message, which are being returned within 24 hours. So there's a few different options for virtual visits. And then some clinic hours are also available. Emergency departments are still caring for every other type of emergency, although in some ways we're happy to see that people are being more discerning on what they're considering emergencies. So we've seen a lot less of minor care or urgent care type visitations to the emergency departments. But that doesn't change the fact that, if you're having chest pain, if you're having something that could be stroke symptoms, if you have something that you have a concern for, the emergency departments are still providing that care.
All right, Doctor, I appreciate it. I know how busy you are. We're going to let you go. Thank you so much for being with us. We're going to keep in touch, I hope, if you don't mind. If you have anything you want to share with the public from Henry Ford, let me know. Thanks again for all the work that's going on. I know there's also a lot of research going on right here in southeastern Michigan to try to find an eventual vaccine and treatment while people are in the hospital. So I salute you, all the people in the research community. We have great hospital systems here, not the least of which is Henry Ford Hospital System. And please extend our thanks to every single person that's keeping people alive at your facility. And thanks again for joining us today.
Great. Thank you for having me.
He is Dr. Manu Malhotra, the Chief Medical Officer at Henry Ford West Bloomfield, and we really thank him today for joining us here on the Megacast. All right, I owe our radio stations a legal ID. Going to do that right now. 89.3 WBLD, Orchard Lake, West Bloomfield, Keagle Harbor, Sylvan Lake. 88.1 WBFH, The Biff. I didn't do it right, did I, Tyler? 88.1 WBHF, Bloomfield Hills. No, all right, was that good?
It's you got the last couple letters mixed up. It's 88.1 WBFH Bloomfield Hills.
Yeah, I said that. Didn't I say that right?
You had the H and the F, but
88,
all the right letters.
they're all in there. I think the FCC would give us a special exception in a crisis. And WAHS Auburn Hills, thank you very much. Our radio stations, we're going to take a break. We are on Civic Center TV. We are on the Bees in the D website. So I don't know how your weekend was, but Tyler, my weekend was really kind of a bummer, sitting around the house for the most part. And I know I saw some people getting out. I went out for a walk and a quick bike ride. But our Recs departments around our listening area are really doing a good job. We're going to talk to a couple of them in just a couple of moments. We'll check in with the Auburn Hills Recreation Department. We're going to check in with the West Bloomfield Recreation Department, and we're going to find out all about bees in the D, and that you can see on your screen right now, the Bees in the D folks. We're going to talk to Brian Peterson and our Parks and Rec departments in just a couple of minutes. You are watching and listening to the Megacast on our great radio stations, WAHS 89.5 Avondale Community Radio, 88.1 WBFH, the Biff, 89.3 Lakes FM, Civic Center TV, and we will be right back.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds. Especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
All right, welcome back to the Megacast. My name is Dave Scott. His name is Tyler Keefe. I will let him get a word in edgewise before the broadcast is over. Oh, man, we've been so busy. We've not even been able to get to most of the stuff today. We had the governor's press conference. I got so much in my stack here. We'll try to continue to get through it, but we have some wonderful guests who we really appreciate standing by. Joining us on the line now is Sarah Hegdal. She is the Auburn Hills Recreation Department Director, I assume. Sarah, is that correct?
Yes, it's Sage.
Oh, Sage. That's what it says right here on my sheet of paper. It says Sage. Forgive me. I had my thumb over it, and all I saw was yes and everything. Okay. So you're the director of the Auburn Hills Recreation Department. Is that correct?
That's correct.
All right, great. So now everybody can see you on Zoom. Thank you very much for joining us. You probably know your friend Jennifer Tucker over in West Bloomfield. She's going to check in a couple of minutes, and we're going to find out all about bees in the D. But right now, by the way, thank you for joining us. Say hello to everyone in Auburn Hills for us. And anything you can do to spread the word about this broadcast, we appreciate it. We're here to get coronavirus information out every day. And we thank all of our radio stations and TV outlets who are working on more. You're doing some pretty amazing stuff too, Sage. You have a virtual recreation program going on. Tell us about it.
Right. Well, when all of our classes and programs were canceled, we just immediately thought, what can we do to continue to engage with our community and do the things that we would normally do, like offer the different types of programming that we do, whether it's nature programming, health and wellness, physical fitness, those types of things where people depend on us to provide a good quality of life for them. We just wanted to continue to do that in any way that we could. So we just started trying to do some activities and some virtual classes on Facebook and a little bit on Instagram as well.
Well, that's a great idea. It's a great idea. So how does that work, and what kind of classes are you holding?
Well, we just started over the last couple of weeks. So one of the things that we're trying to do is just some family engagement activities. So those types of things would be challenging people to build something with Legos and to post a picture of it on our social media, or to do a puzzle or to build a marble run or those types of things that are non-screen activities where kids can be engaged with their family at home and still engage with their community at large through Facebook. So those types of at-home engagement activities. We're also doing virtual field trips. So what we do with that is we have some video that we're putting together as a field trip. Our first one airs tomorrow, and that's of our new Nature Center Lodge out at our Nature Center. But then we also have our police department coming up, our fire department coming up, and then our DPW building, so people can kind of see what's going on inside those areas during this time and how they're still working around the clock to protect us and keep us safe during this time. So we'll get a little inside peek at that. We're doing nature activities and outdoor education. So what we would normally do as a class, we're just taking a video of and trying to adapt the things that we would normally do in person to something that families can do at home. Or if they choose to go to a park, some of it is activities that they could do while they're at the park.
Sage, I saw that that the state said that the state parks, for the most part, are open. We are allowed to go outside to get some exercise. Now, we certainly want people to put on a mask, but we are allowed to go out. Are the parks in Auburn Hills open? Are people using them? And how's it going?
Yeah, the parks are open as well as the trails, such as the Clinton River Trail. The restrooms are closed, the water fountains are off, and our playgrounds are closed, as well as our basketball courts. Our skate park is also closed. So green spaces and trails are open, but facilities and other areas that pose a higher risk are closed. And it's going pretty well for the most part. I think the important thing is that we all need to work together to observe what the CDC has put out for us, you know, with the 6-foot distancing still in parks, making sure that you follow the CDC's guidelines on hygiene prior to coming out to the parks, warning people if you're gonna pass, if you're on a trail, letting them know that you're there, wearing your mask.
It was so funny, Sage, it was so funny the other day, if I can interrupt. It was so funny. I was out riding my bike, and as I got close to anybody, they would like go off in the other direction. So people are, people are getting it. It's beautiful today. Yeah. It was beautiful over the weekend. I think people are figuring it out. We got to run along. I got so much news.
Okay.
I want to thank you very much, Sage. I'll never call you Sarah again. Sorry about that, but I want to thank you. Okay. Bravo to you and the Auburn Hills Rec Department. We're going to talk to the West Bloomfield Rec Department and other folks. I mean, listen, this is hard. I mean, let's be honest. This is hard on everybody right now. And I appreciate everything that's going on in all of our communities to either save lives or make things a little bit better. I can see you're working today to try to do that. So thank you for joining us. And tell everybody to tune into the Megacast. And right in your area on 89.5 from 10 to noon. And if you got any other news that the local communities should know, please check in with us, okay?
Right, we will. Thank you.
All right. Thank you, Sage. I really appreciate it. Just Tyler, just another person here making a big difference in our community, trying to help people get through this. So we appreciate Sage joining us.
And doing it in a unique way also. Auburn Hills has their unique ways of navigating this crisis and still providing their services. The virtual field trips, it's something that's unique to them that's really interesting, and will keep their community and other communities even engaged in nature and recreation during this time.
Great idea. Hey, Sage, I see you're still there. If you want, we can make you our Facebook partner one of these days too. So I'm sure you have a Facebook page, right? So
we do.
We're going to call you, okay? We're going to call you and ask you if we can put our video up on your page someday. And you can't say no if I ask you while you're on the air, right? So I'll take your yes, all right?
Yes, Auburn Hills Parks and Recreation.
All right, we'll call you and hook up with you. Thanks, Sage. We got a ton to get to. Let's take a minute now, just kind of go through the list of things that I made at the beginning of the broadcast, Tyler, and I haven't even had time to get to them. Certainly, we've had the governor on today. It was really great to hear from Dr. Manu Malhotra from Henry Ford West Bloomfield Hospital. Not just from, but he's the Chief Medical Officer. Great insight from him, and we'll post that up on our website. If you've not been to our website, we invite you to go to civiccentertv.com. Tons of information, and we'll try to get to some of these headlines, but go to the coronavirus page, and you're going to find a wealth of information. You're also going to find interviews from the past several days, and if you hit the Watch Live link, you can see this show and also participate in the broadcast while we're live, or go back and watch archives. Quickly, couple of headlines that poked out at me. A, construction is non-essential in Michigan. And I'm not picking on the governor here, because she's got a really tough job. I'm just making an observation. Construction is non-essential work in Michigan. That means home construction, building construction, Tyler, is theoretically not going on right now. But in all the other neighboring states, Wisconsin, Illinois, Ohio, and Indiana, that work is going on. So I don't know whether it's been clear or not, but we're going to keep an eye on that. Try to talk to some folks tomorrow. Maybe we'll go back to the road commission. I believe road work is going on right now. I thought I saw some guys working on the road today.
Yeah, I thought I had seen them too over the weekend. I'd seen some crews. Last we spoke to Craig Bryson, there was no indication that road work was going to be completed.
Other headline today, of course, is what's going to happen tomorrow. Our legislature will be in session. I was totally confused by the governor's comment today, and I'm sure some of the other members in the media are going to get to the bottom of it. But the governor put in a state of emergency for Michigan. She began the order on March 10th, and it was only valid for 28 days under law. After 28 days, the legislature has to get in and approve it. Now, they're voting tomorrow. The governor said that they were considering adding only 1 day. I'm not doubting the governor. I'm sure that's the information that's made it to her desk. Doesn't seem to make a lot of sense. The media reports that I saw said the legislature was going to extend it by another 28 days, and she was asking for 70 days. So I think there's some confusion there as to what the start points are. I hope they get this all worked out, because we don't want to see our lawmakers go through all they're going to need to go through to be in session and then vote on 1 day. I agree with her, but it doesn't make any sense. I hope some reporters get to the bottom of it, and I don't know why the legislature can't vote and have a session on Zoom like a lot of municipalities are doing. We're doing it in West Bloomfield. We got a Zoom meeting tonight in West Bloomfield. I know a lot of the other communities are doing the same thing, so I don't want to get in the middle of a fight. I'm just making an observation. Great to see from the state of Michigan the parks are open, and we're going to talk more about parks in our local communities. Good to hear from the folks in Auburn Hills. We'll check in with West Bloomfield in a couple of minutes. Earlier today on the program, Matthew Pillsbury, pilot, was one of a number of pilots and a leader of the pilot community. Cran Jones, who called a manufacturer down in Indiana. They said, hey, can you make some face shields? They made them. And then the pilots got them up here right away on Friday. What a great use of resources, Tyler. That's exactly what we need to be doing, and I've stressed it a couple of times, but I can't say it enough. The Paycheck Recovery Act. This is huge for small businesses right here in West Bloomfield, Keego Harbor, Rochester, Auburn Hills, Pontiac, all across our listening area today. And by tomorrow, I'm going to try to get some input from some local bankers. The way it works is you file with your local bank. And the president over the weekend said, hey, it's going great. But just from my own personal perspective, the front line of the coronavirus in West Bloomfield, which is what the show is all about, Tyler, I can't get a hold of my bank. It's like people filing for unemployment, right? You can't get a hold of the unemployment page online. So we're all going to be patient, but there's only so many dollars. So we want to hear and figure out what's going on. So I'm researching that to try to get the answer. If you're a business person and you have any experience you want to share, if you were already able to talk to your bank, I would love to hear from you. Send me email or call me. Our telephone number, 248-683-2343. It's 248-683-2343. My email, dave@civiccentertv.com. Dave@civiccentertv.com, or just go to our website, fill out the paperwork there. I would love to hear from a business that's made that work. Because that's what this show is about. We're trying to talk to local people and find out what's going on. And Tyler, we'll keep an ear out, see if anybody gets a hold of us today. I'm sure we're going to hear from a lot of people.
Yeah, everyone's seems to be having their own obstacles to overcome. The people that are out of work are overcoming obstacles getting their unemployment. And these small businesses, there's so many of them in the state of Michigan, and especially in southeastern Michigan, that are all in line and all need just as much as the next one. So there's got to be some common ground there. And if there's any way to expedite that process, it's going to be helpful for every other small business in your community.
All right, so we'll keep an eye on that. We're keeping an eye on an awful lot of stories, and then one of the big stories here in Michigan right now is the parks around the state of Michigan are open. We know the parks are open in Auburn Hills. We just talked to Sage in Auburn Hills. Let's head over to West Bloomfield, talk to Jennifer Tucker, our good friend, who we see on screen with a big smile. You're always happy, Jennifer Tucker, even during challenging times. She's the executive director of the West Bloomfield Parks and Recreation Department. How's it going, Jennifer?
Fantastic. How are you doing?
You know, I'm doing okay. Listen, I'm happy. I'm healthy. I got together with my family over the weekend. Wait, don't freak out. We did it via Zoom. It was so much fun. We all did I got family all over the place. So I feel very fortunate. I understand not everybody is so lucky right now, but I feel fortunate. And you look like you're doing well. How's everything going at West Bloomfield Parks?
We're doing as well as we can. We're learning some new things, learning how to do some new things better. And, times like this, it just shows your true colors. So, and how innovative you can be when needed.
I think that's a great point, and we're doing that in my business. We're doing that here with the radio show. We had these radio stations that weren't being really used at area schools. We've got 3 radio stations we're on right now, and we're trying to be innovative and work real hard, put all of our efforts into the show. I know you're doing the same thing on the park side, right? Trying to figure out new ways to get things done during this time.
That's for sure. We are, trying to still encourage people to get out and get active, and the same time educate people that we really need to keep that 6-foot distance. It's so tough when you see people that you would really like to go up to and have a close conversation. This morning I was at the fire department and we had the same problem. Our coworkers we haven't seen in a long time, but we just want to be close to them, but we just have to make sure that we keep that 6-foot distance so we can make sure that we keep everyone safe.
Well, we got all these people running around saying what a great job our first responders are doing, what a great job the medical professionals are doing. But, if you walk outside and you sneeze in someone's face, then, you're not really helping out. This is cool because we all as Americans have the ability to be a part of this thing and make something good happen. Thank you for your sentiment and your words. They are greatly appreciated by me and I'm sure everyone listening. So we're going to try something interesting here. We've not been doing a lot of this. We are connected via Zoom, and I believe we have Brian Peterson, who is also with us from Bees in the D. Jennifer, before we go to Brian, can you tell us all about Bees in the D?
Sure thing. We started to partner with Bees in the D a few years ago, and between ourselves and the Henry Ford Hospital. Henry Ford sponsors the bees, and we put the bees on our property. Currently, we have some at Shulock Farm, and then also now we're moving some to Carner Farm. So basically, we really are working toward increasing our pollinator count locally. So we really need to walk the walk and increase our pollinators.
Well, I know you people probably don't know this about you. Amongst your many talents, you are also a beekeeper. So bees are really important. We've had essentially almost a bee crisis here in our country without enough bees. And so while this other thing is going on, we got to make sure we still pay attention to that. With that said, let's see what Brian has to say. Brian Peterson, I believe we have him now via Zoom, and there he is, Brian. You're looking good. We see on TV, Brian, for those listening on the radio, Brian is standing in front of a bee operation. You can tell us about it with his mask and gloves on. Brian, welcome to the Megacast. How's it going out there, and where are you? Describe what we're seeing.
Well, thank you for having me. I'm at the Outdoor Adventure Center. You can see it behind me here, which is right along the DeQuinder Cut. And we have 4 hives here at the Outdoor Adventure Center. And this one's a special hive because you might see some cords going in. We have a solar panel above our head, which was provided by DTE. And that projects or gives power to the camera inside of the hive that then projects into the center so that people can see what's going on inside of the hive, right inside of the Outdoor Adventure Center.
You know, Brian, no offense, but, you're a brave man. Are there bees in that hive right now?
Oh, yeah, it's starting to get a little active now that the temperature's rising. And, they're here. What people don't understand is honeybees are actually very docile creatures. A lot of times we get them mixed up with the wasp and the hornets, especially the yellow jackets.
Well, listen, I don't like bees, any kind of bee. I just don't like getting stung personally, and I'm a tough guy, you can punch me, you can pound on me, but you get a little bee around me, I turn into a big old crying baby.
Well, you don't have to like bees to appreciate bees, because if you like blueberries and almonds and most of the foods we eat, you like bees because they help provide a variety of food for us.
So during this coronavirus crisis, we got to keep the world going. We got to keep our food chain going. We have to keep doing essential things. Do we have, as long as we're here and you're outside in this amazing facility, do we have a bee crisis here in our country right now?
Yeah, unfortunately, our pollinator numbers they've stabilized a little bit, but they continue to drop. That's not just our honeybees. That's also our native bees, the solitary bees. And they really are important to our food industry and to our ecosystem. So, yeah, there is a problem, and that's one of the reasons we started Bees in the D. But as a teacher, I'm a 5th grade teacher, and I teach at Open University. It's very important to get the word out of the importance of our bees and what they provide for us.
All right, so now I got a million questions. So you teach at Oakland University. You are a 5th grade teacher. You do the bee thing, and I can't imagine with all that going on, you have time to be on our broadcast. We went to your Facebook page. By the way, thank you very much for putting our live broadcast today on Bees in the D on Facebook. We greatly appreciate you connecting us to your audience. So tell people what we're looking at for those that are watching and what's important for people to know.
Well, first of all, I'm lucky enough to be on your broadcast because it's actually, I know it seems weird to say this, spring break. And so I'm on spring break now along with all the kids. But so I'm sorry, what did you want me to share
So
about?
that's clearly a beehive right there that you're leaning against. Is it safe to be leaning against all those bees? And what should people know about a beehive?
Well, actually, honeybees like to live in an empty cavity. So it doesn't have to be man-made boxes. It can be an empty tree. But for hundreds of years now, man has, and women now, of course, we have many women beekeepers in our organization. Humans are now using boxes to actually raise bees, if you will. They're part of the agriculture. So that's an interesting twist to all that's going on. The governor, I'm wearing the mask under her recommendation, but they want you to stay at home. But agriculture is still part of essential roles that we have. And so I have to come out and check on these hives. This is a really, we're getting now out of the winter season, but this time of year is very difficult for the bees because they're running out of extra reserves. So just the other day, I put in some extra food for them, but they are starting to come in and out and bring in pollen and nectar from the early blooming trees and some of the early blooming flowers like crocuses and snowdrops and daffodils.
All right, so I'm dying to know. I know Jennifer Tucker's going to laugh at me because she's a beekeeper and I know nothing about bees. But can't the bees just go to takeout at Wendy's? What do bees eat?
So bees actually have two main things that they're looking for out in the field. They're looking for the nectar and the pollen of plants. And that's important to us because they are cross-pollinating when they're getting that pollen, which then allows our foods to go to fruit. So you name it, if it is out there and it's blooming, that's what the bees are looking for. So some of the trees I'm looking at right now have these big buds, and we don't think of like maple trees, with flowers, but they do have small flowers. That's what becomes those helicopters. Well, those little flowers have nectar in them and pollen that the bees bring back to make the honey that we all love and that they love.
All right, well, I want you to look at that tree right near you and then whisper to the bees while you look at that tree. Just point at it and say, "This bud's for you." I don't know if that'll help or not, but there you go. So you got to get out there and maintain them. If you're not maintaining the bees, then we got a problem. We already have a problem. I assume during a crisis like this, there's just so many little things that need to keep us fed that are part of the system. This is one. I appreciate you pointing it out. And you're in kind of a populated area. You said you're by the DeQuinder Split. Do bees do okay in a quasi-urban setting like we all live in here in southeastern Michigan?
So Bees in the D is pretty fortunate that we are spread out throughout southeast Michigan. Most of our hives are here in the city, up on rooftops or here on the DeQuinder Cut. But we also have bees out in the suburbs, like at West Bloomfield, and we're way up north, like at Blake's in the more agricultural or the rural areas. Our bees actually in the city locations, and there's a lot of studies on this. Our friends at Best Bees have done studies about this. The bees actually are doing better in an urban area than they are in some of the more rural areas.
Well, we certainly aren't right now, but I'm glad at least one population is doing fine, and the bees are. Thank you for your hard work. For kids that are at home, parents that are trying to teach them, do you have resources on your Bees in the D Facebook or webpage that parents can go to and share this story with them? Maybe it'll be helpful in homes around our listening area.
Yeah, so much like Sage and Jennifer, we've gotten very creative because I have had to reschedule or cancel already 12 to 20 of my workshops or my talks. So we're trying to switch a little bit online. We have a volunteer workshop coming up on the 19th. That's via Zoom. We'll see how that goes. We have wonderful volunteers. But we also created a Bees in the D junior page where we have links to, I put together some activities and some different lessons that parents, teachers, kids can do at home that allows them to explore the wonderful world of our bees.
Well, Brian, thank you very much. Thank you for hosting our broadcast. We'll do this again maybe sometime when you're not wearing a mask. We'll get you in the studio, and we'll talk bees a little bit more. We know they're important, and this is a really good study lesson and activity for people that are looking for something to do with their family. And thank you for your part in keeping the food chain in good stead here in the state of Michigan. We salute you. We thank you. Great job.
Thank you. Thank you for having me and letting me share. And maybe in the future, we can do a virtual beehive tour, and I'll actually take you in and open up the hive so you can see the bees.
I'll be nowhere in the neighborhood, but I'll watch from here in our studio. So thank you, Brian. I appreciate it. Hey, I'm going to skip along. Good to talk to you. Jennifer Tucker, any final words or anything else that you want to ask Brian that I might not have asked him?
No, nice to see you, Brian. But Dave, I would like to tell you just to be safe.
Well, thank you. You be safe, too. You too, Brian. All right, we're going to take a break. We got to get back to the news of the day. Nice to have a couple of minutes to lighten it up. You guys keep up the great work. Jennifer Tucker and Brian Peterson. Jennifer Tucker, of course, the director of West Bloomfield Parks and Recreation. Brian Peterson from Bees in the D. Check out their Facebook page, and you'll see our broadcast there right now. Take a look at them online. Go Google them. A lot of really cool organization here in Metro Detroit. We will get back to the news of the day. We're going to head over to our website, take a look at some of the carry-out restaurants available for you, and talk about some of the assets and some of the things you need to know as you go through another very challenging day. Let's not forget, as we lighten things up here, we are in the epicenter of a pandemic. And right here in Oakland County, tragically enough, and even a little worse in Wayne County, we have some of the worst numbers in the country. And we are, as everyone has said, right in the peak of it. We are right in the thick of it. So we'll talk about the things you can be doing to make a difference and share some of the top headlines and the resources that are available to you through this broadcast when we return. I'm Dave Scott. He's Tyler Keefe. He'll join in on the conversation in just a couple of minutes. And we thank you for joining us at Bees in the D on Facebook, Civic Center TV, of course, civiccentertv.com online, and our great radio stations. We have massively expanded our radio coverage for this broadcast, so a huge thank you to WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, and our own 89.3 Lakes FM. We'll be right back.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
All right, welcome back to the Megacast. Dave Scott here, Tyler Keefe, along with the rest of the crew. Literally, I was going to say thousands of people behind the scene, but I'm not going to exaggerate today. We do literally have 10 people working on this broadcast every day, and I just want to salute the folks at my operation, Motown Digital, who have all shifted away because, Tyler, there is no work right now in live event work and business. That's what we do. But we also work here at Civic Center TV, and there's an awful lot of work that can be done here. So we've kind of rebuilt our business over the last couple of weeks, and we are here putting this broadcast together. Very satisfying, and we hope that this is helpful information to you. The core of all of our helpful information is on the civiccentertv.com website. We are all working really hard every day to pack it full of information. You just heard from Oakland County. There's a whole page here on the website, if you're watching on TV right now, with direct links to all of the Oakland County resources. There are a ton of them. And all you got to do is just go to coronavirus, and then you can see all of our different community links right at the top of the page. You can see the Center for Disease Control, the state of Michigan, all our townships and our cities and our communities here are all listed, and each of these communities has very helpful information. So big day today. Governor had a lot of comments for us. 85% of Michigan patients who are suffering from the coronavirus are here in southeastern Michigan. She said look for an additional order coming up next week. Legislature is meeting tomorrow to talk about extending the state's emergency order. Many people around our area are applying for the Paycheck Recovery Act funding to help keep people employed and going to banks. You do that with your local bank. If you've not talked to your local banker and you're a business person, you want to do that as soon as you can. Don't forget that we are doing all we can here to do the basics, Tyler, and that is right on the front line. We've got to keep our area clean. Right? Yeah, we haven't gotten the wipes out here in the last little bit, but I know you need to keep wiping down the surfaces, washing our hands. I need to go to the grocery store today, And I got to just go through this tips right here on the website. If you go to the coronavirus page, you can find information on what you're supposed to do to get your groceries inside. Larry Nyland, one of our producers, I like his idea. He said just leave your groceries in the trunk for a couple of days, at least the non-perishable ones, because the virus only lives on surfaces for 3 days.
Yeah, when I deliver, I've delivered groceries to my dad because he's immunosuppressed. He's got multiple sclerosis, and he takes infusions that take out his immune system.
Sure.
And so this weekend, I got groceries for him, and anything non-perishable, I put on a clean towel in his garage. I wipe it down with wipes. I spray the external portions of it with disinfectant spray, and anything else I wipe down and put in a specific area that he'll wait a half hour.
Well, this is going to be the ultimate in patience for the host, because I have never gone to the store and bought groceries and waited 3 days before I eat them. I see that. I could do a lot. I'll stay at home for a couple of months. But you want me to buy groceries and leave them there for 3 days without consuming them, Governor? That is one step beyond the...
It's one step too far.
I'll do it. I'll do it. All right, we have our COVID-19 vocabulary. These are words and terms that Tyler will help us define. Flatten the curve.
Flatten the curve is an effort to reduce the exponential growth of COVID-19 cases so as to reduce the severity of the spread of the virus.
All right, we're hoping that we're close here. I mean, they're saying this is going to be a hard week. We know, in all seriousness, that people are losing their lives in big numbers here in Michigan, and more people are contracting the disease. That's why all these other things that we're talking about right now are really important, like social distancing. Cross out the social. That's what everyone's talking about. Everyone talking about social distancing. Here on our show, we talk about physical distancing. Explain.
Yes, absolutely. Keep on socializing with people, but do it at a safe distance, at least 6 feet, to reduce the spread of the virus through the air.
If you are asymptomatic, that means you have the coronavirus, but what don't you have?
You're not showing symptoms necessarily of the virus, so people may not know as they're walking by you, as they're interacting with you, that you're holding the virus.
You know, they may be asymptomatic people. They may be the big winners, really, because you get the coronavirus, you don't get any symptoms, and maybe, do you think the asymptomatic people are building up antibodies?
It's possible that they may have a better immune system reaction to the virus, but at the same time, they are the ones that really need to be staying at home.
Yeah, that's the point. The point is you could be sick and don't get anybody else sick. But I wonder if they're asymptomatic and they get the coronavirus and then they go through it and it leaves and they don't really have a lot of symptoms, are they going to have antibodies afterwards, and what special stuff do they have in their blood that kept them from getting really sick? And I imagine the amazing scientists in our country will figure that out, and that will help us get to a vaccine. New normal.
The new normal is the new status quo, so to speak, of how we are living during this coronavirus outbreak.
Curbside testing, and now it's going to be 15-minute curbside testing.
That is getting tested for the coronavirus, whether or not you have contracted COVID-19 in a very systematically set up environment.
We had good news. You might see it on our news sites. Abbott Laboratories came out with that 15-minute test kit. Really helpful as we try to figure out the numbers, what's going on in our communities, and those test kits are in the city of Detroit where we really need them right now. That's great news. Stay-at-home order.
Stay-at-home order was what was issued earlier on in March by the governor for all non-essential personnel to remain in their homes for the duration of the order so as to reduce the spread of the virus.
I don't know about you, but I hate these three-letter acronyms that we have in so much of our society. The big one right now is PPD.
Yeah, so PPD, I've also seen PPE as personal protective devices or personal protective equipment.
That's what I had. I had PPE written down, but then I changed it to D. I thought I made a mistake. But it could be either one.
Yeah,
a PPE
I've heard
or
both.
a PPD.
I've heard both. And that PPE, personal protective equipment, includes N95 masks for medical professionals, gowns and headgear for medical professionals to make sure that they have what they need to treat patient after patient, because to keep the environment sterile, you have to switch those out after every interaction with a coronavirus patient.
Headlines today at civiccentertv.com/coronavirus. You can go to civiccentertv.com. And here are the stories you'll find. In addition to links to all of our local municipalities in the state and federal government, you'll find these stories that we've collected for you on the coronavirus. Michigan State's parks, trails, boating facilities remain open. Social distancing. They got to put the right term. Physical distancing maintained, please, ladies and gentlemen. Oakland County pilots fly to Indiana to pick up medical supplies. That is our feel-good story of the day. Read the full story with the link there and find out about your friends, your neighbors who are coming to the aid of our first responders and our hospital workers. Hey, how about Ford Motor Company? They ship out 1,000. No, there's more zeros. Ford Motor Company ships 1 million face masks in 1 week. Only 1 week after Bill Ford announced that Ford Motor Company would mobilize as part of the arsenal of health, the Detroit automaker has manufactured and shipped 1 million face masks. Yes, that is,
fantastic.
you know, doesn't it make you proud to be a Michigander?
Oh, absolutely. They're doing great work. They so quickly shifted their entire operation to helping medical professionals and see the results. It's fantastic.
All right, and with Easter coming up this weekend, a lot of people will have to get together virtually. Same is going on in the Jewish community. Look at this. Stage Deli in West Bloomfield is preparing Seder meals. Stage Deli is open, taking orders for the Jewish community, marking the big Pesach weekend this weekend. So is it this weekend?
I believe so.
I should know these things. But they are preparing Seder meals for Passover. You can find all the information on the Stage Deli site. I saw notes in my family they're going to do an online Seder, so I haven't really been looking at my calendar because I've been so busy here. National Guard giving us help to make sure the food banks in Michigan are doing their thing. And you know, if you want to feel good, we got to go in a minute, but if you want to feel good, just check in with our good friend Mitch Albom. We got an article and a link to Mitch Albom's, one of his recent columns in the Free Press. Headline: Mitch Albom shares the one thing keeping him happy during the quarantine. So that's about it for today. Tune in tomorrow. We're going to have a whole lineup of guests here. We're already putting together a great schedule for you for tomorrow. Our effort every day here is to get local people with local information and a local perspective on what you're seeing. We're on the front line of it. All of us are living it every day, and we look forward to you joining us again tomorrow. For many of you, you can hear these broadcasts repeat throughout the day. You can also go to civiccentertv.com and listen to the entire broadcast or watch it. And all the information that we talked about today is up on our website. Just go and take a look. I think I got to say so long. Is it time?
We still got a couple more minutes to go until the top
I
of
thought
the
that
hour.
said 58, not 56.
Oh, no, we are just coming up on 57, Dave.
Okay, so I do now. What do? I have a whole nother minute here. I don't know what to do with.
Well,
So
let's talk a little bit about what more we have broadcasting today. Tonight, again, we have another municipal meeting that's being done virtually in the spirit, of course, of physical distancing,
Okay.
by maintaining social interaction and legislation. It's
Only
going
for our listeners in West Bloomfield, though. But for our West Bloomfield listeners, meetings go on, you know. And again, we talked about it a little earlier. They're going to do their municipal meeting, as I'm sure other communities in our area are holding their municipal meetings via Zoom. We've seen a lot of that. I don't know why the legislature can't meet via Zoom tomorrow, but so be it. So that meeting for West Bloomfield folks tonight at 6 o'clock. If you're dying to know about West Bloomfield politics and you live in Auburn Hills, I guess you could tune in as well.
Yeah, or at least to see the process. If you're interested in seeing the process or and seeing how other communities are weathering this crisis and continuing to move their municipalities forward, it's an interesting thing to watch.
Well, it is. And, you know, it may be helpful to your business, your family, others who want the opportunity to be able to communicate via Zoom. Oakland County Executive Dave Coulter was on the program on Friday, and I really like what he said. I just want to go back and play this one clip, and it came up when we were talking to the folks at Henry Ford today, is that we know TCF is coming online this week, but we do know that we're going to need more beds in Oakland County, and here's what our county executive had to say about that Friday on the Megacast.
I do believe that additional beds are going to be needed in Oakland County. I don't think it's a secret that we've been talking about the Suburban Showplace Collection Convention Center in Novi. That is, we've been working with the U.S. Army Corps of Engineers on what it would take to convert that. The conversion isn't the hard part, it's staffing it. Our hospitals and their workers are challenged because they have folks that are in quarantine or positive as well. So getting the medical personnel to operate a field hospital is a huge challenge, and that's kind of what we're working through right now.
All right, Oakland County Executive Dave Coulter, we appreciate him taking time for us the other day. And I thank you. Again, go to civiccentertv.com. Go to our coronavirus page, and you will find a ton of local news and updates surrounding the coronavirus and information helpful to you and your family. Go to the Megacast page, and you'll see information and previous interviews we've done in previous days. A lot of helpful information there. And if you're getting hungry and you want to find a restaurant here in our area, just go to the Carryout Club, and there you will find a complete listing of restaurants all across our region that you can go to and get some great carryout. That's going to be it for today. Thank you very much for tuning in to Civic Center TV, civiccentertv.com. Thanks to Bees and the D for being on the show. Brian, we appreciate it. Thank you for posting our show on your Facebook page. And a huge shout out to our radio stations, WAHS 89.5 Avondale Community Radio, 88.1 WBFH The Biff, and 89.3 Lakes FM. Thank you very much for joining us and tuning into the Megacast. We'll see you tomorrow.